Welcome back. You're a very obedient crowd, and we totally appreciate it. We have a great rest of the morning. So the question is, what happens when our rational minds feel as though they've been hijacked by something we cannot control? It's a question posed by Dr. David Kessler, former head of the Food and Drug Administration and former dean of Yale Medical School, in his new book that is out today, Capture: Unraveling the Mystery of Mental Suffering. Kessler has a theory about how and why people become fixated and how that fixation manifests itself in mental illness and addiction. Let's let him tell the story in his own words with a little help from our Atlantic animators.
20 years ago, when I was at FDA, we launched the investigation in tobacco. I had to learn everything I could about nicotine. Why does the smoker pick up that cigarette and smoke 780,000 more over a lifetime? Why does that cigarette become so powerful? Then I became very interested in food and in overeating. So that power to get me to do something that I didn't want to do, but I was going to do it anyway, I began to wonder whether that power of how a stimuli can capture our attention, how that plays a role not just in addiction, cigarettes, or drinking, or eating, but what about other stimuli, ideas, objects, thoughts, feelings? When you look at someone who's depressed, they can't shake their attention being focused but on negative things. And someone who is manic is focused on those things that are going to make them feel good. And at the core of that range of disorders, what you see is the selective attention that has the ability to affect how we feel. Capture is how our attention focuses on one stimuli rather than the thousands of others that are bombarding us. Capture is neutral. We can be captured by things that are positive or negative. But what's key is not that there's a chemical imbalance, but rather that there are these neural circuits that we're all vulnerable. And you can explain a range of disorders, the obsessions, the phobias, the addictions, by looking and seeing what is the object of capture. Pick any form of treatment. Let's start with drugs. What drugs do is they dampen my reactivity, and I feel things less. Psychotherapy, in essence, gets me to look at the world differently, hopefully to be captured by something else. Spirituality gets me to try to distance myself from the stimuli. They're trying to affect this process of capture. Capture is part of all of us, but why do some of us become captured by something, someone's captured by something else? What determines that? What captures us is intensely personal. Every capture is the result of prior captures. But what capture does is it tries to pull back the curtain on mental illness and says that there is a fundamental mechanism to which we're all vulnerable, and it's just the way our brains are wired.
We're delighted that Dr. Kessler is here with us to talk about this whole notion of capture and what it takes to free oneself. He's joined by the American Medical Association's Dr. Patrice Harris, who chairs the task force to reduce opioid abuse. Atlantic editor Ross Andersen is back to lead the conversation.
Okay, I'm very anxious to talk about your fascinating book and that video. But I want to start, Dr. Harris, with you and the work that you're doing on opioid addiction. And I want to start at a fundamental level. I was hoping that you could tell me a little bit about pain, just what it is, how doctors think about it from the sort of physical pain and mental pain.
Well, first of all, thank you, and thanks for the opportunity to be on this panel this morning, particularly with Dr. Kessler. So it's an important question because it gives us an opportunity to impact what we mean by pain and really make sure we are using appropriate and specific language. So when you talk about physical pain, it's a very complex phenomenon. We look at physical pain from a biological, psychological, social, and even now cultural standpoint. And so it's important to understand all of those aspects and unpack pain in that matter. And there's much research on pain, but I always like to say when I'm dealing with the patient, the N of one that's in front of me, it's important to understand pain in the context of all those dynamics. When you talk about emotional pain, mental pain, psychic pain, all words that are used, but critical really to unpack those. I am a psychiatrist. We're talking about a patient who's depressed, who has PTSD, who's anxious. So it's important to look at those words and labels, but really at the end of the day, it's important to unpack pain in the context of the individual person as a physician sitting in front of me.
Dr. Kessler, in your book, you have this fascinating chapter on David Foster Wallace, who experienced deep depression, and that's been reported in the press for a long time. But in sort of unpacking his story, and especially through the lens of this book, what did you learn about his experience and his sort of mental pain?
Deep depression, deep pain. From an early point in David's life, he wanted to be exempt from the ordinary. He wanted to excel. He wanted to excel first as a student and then a writer. Yet, whenever he would receive an A+, whenever there'd be a standing ovation at one of his book talks, he grew uneasy and then despairing. He had this sense there was just something false about himself. He termed it the fraudulent paradox. You use the word depression. What's depression? Right? I mean, what we've done is we've taken a label and have said that label is the cause. But what depression was, certainly in David's case, was this constant filtering out of anything positive and a focus on what was salient to him, right? The negative. Let me just read you a quote that he wrote. You asked about pain. He wrote, he could not perceive any other person or thing as independent of the universal pain. Everything is part of the problem. He could be funny and loving at times, but the focus, that capture on the fact that he thought he was a fraud generated such pain, such depression, that it led to his suicide.
And Dr. Harris, as a doctor, when you go to treat a patient like that, or a patient who's dealing just with they've just had surgery, so it is almost a purely physical pain, what sort of toolkit do you have? And maybe how do opioids fit into that toolkit?
Well, certainly if you're talking about physical pain, we want to make sure that we have as many tools in the toolbox to treat physical pain. Of course, as a psychiatrist, I would need as many tools in the toolbox to treat depression and other psychiatric disorders. But opioids are an important piece of the puzzle when we are treating pain. But we do know today that there are other evidence-based treatments that we want to make sure that our patients have access to. Cognitive behavioral therapy is a part of that, perhaps. Biofeedback, using a TENS unit. So luckily, unfortunately, there are many evidence-based treatment alternatives for pains, including opioids. Unfortunately, not everyone has equal access to the wide variety and comprehensive treatment modalities. And so we use opioids. They are appropriately used, but we find ourselves at this point in time, and I'm sure the audience is aware of this, at the point of an opioid epidemic. Too many people dying from opioid and heroin overdose deaths. And that's an important point in that the American Medical Association at this point is calling on all physicians to amplify our leadership as the nation addresses this epidemic. As we amplify our leadership, we want to make sure that physicians are enhancing our education and our training related to pain, related to the use of opioids, and related to understanding substance use disorders. And finally, we want to make sure that we work together with everyone to reduce the stigma associated with substance use disorders, and unfortunately, sometimes patients who are suffering from chronic pain.
How has sort of the suite of tools that you use to treat pain changed over the last 20 years? Opioids weren't used as commonly a few decades ago, is that right?
They were not. They were not. Certainly in the late 80s and 90s, there was a recognition that perhaps physicians were under-treating pain. And then there have been the advent then of opioid analgesics. And also, in the context of pain, as I said earlier, we don't have equal access to the alternative methods of treating pain. So certainly we've advanced in the last 20 years with different modalities, but it's about capacity and access. And so folks may have access to pills because perhaps that's what an insurer will pay for, and perhaps an insurer might not pay for extended physical therapy or biofeedback or other alternatives. And so really, and I was talking to someone yesterday about this, it is critical that we address any issue from a comprehensive standpoint. Often we are in our silos. And we have this group addressing pain or opioid abuse or mental disorders in one way. It's really important that we have these comprehensive conversations and try, to the best of our ability, to come up with comprehensive solutions.
It's very interesting when you talk about pain and you talk about the opioids, really this vicious cycle. I mean, it really is, I think, a part of what capture is all about. Why does somebody use opioids? They use opioids to feel better. I mean, take back pain. Right? Most of us have some experience with back pain. I mean, what really is going on? Yes, there's compression of a nerve. There's a physical component. But that's only part of the problems. Understand, I have that physical pain. I have that could be real intense discomfort. I feel bad. I want to change how I feel, right? I take the opioids, right? I feel better while I'm taking the opioids, right? The next time I have this twinge, I have this increased hypersensitivity, I'm increased awareness, because all of a sudden, if you experienced it, right, I'm going to be captured by any twinge. That's going to make my muscles go into spasm even worse, right? Then I'm worse, and then I get cued by that spasm. Then I need the drug, and you end up where this output, right, of pain becomes the input. I mean, to keep this cycle going.
And getting back to the book, one of the things that's remarkable about it is that it doesn't just offer a sort of a model for pain like the one you just articulated. I think you were telling me that it sort of gives you a theory of all kinds of phenomena, whether it's sort of depression, addiction, even Donald Trump, religious faith. Can you sort of explain how?
The book has about 120 pages of footnotes, so it's a serious attempt. But when you understand capture, I mean, we're all wired to focus on the most salient stimuli in our environment. That's part of who we all are. I can assure you, if a bear walked in here right now, that would be for all of us, maybe not one or two of you, a salient stimuli, right? There would be attentional focus, and it would affect how we feel. So I started, you were Commissioner of Public Health, right? I started on tobacco, right? That cigarette, right? Why does that cigarette have such power over certain people? Then I became very interested in that chocolate chip cookie. Right? Then I became interested in depression. We talked about David Foster Wallace, or anxiety, or the eating disorders. What becomes salient in the eating disorders? Food, but it's also the fact that if I can cut an apple into 80 slices, right? And I can eat one of those, like, all I eat is that apple, right, for the entire day. That gives me an incredible sense of control. That could make me feel better with everything else going on. I mean, that's anorexia. Then I started looking at violence. Ted Kaczynski, the Unabomber. What was he captured by? He was a survivalist in Montana, and he started hearing, and he couldn't get out of his head, the jets that would fly overhead. And he would count, right, the number of jets and the snowmobiles. And that led to revenge. Eric Harris in Columbine, right? The way, the injustices that he felt, right, that his classmates didn't take him seriously. Ciron became very upset that Bobby Kennedy was selling to Israel, committed to selling Israel 50 Phantom jets, and he felt that was a betrayal. Mass murder, it doesn't explain everything. ISIS, what are they captured by? One of the strongest forms of capture is ideology. Spirituality, captured by a transcendent. And yes, I mean, if you look, I mean, Trump is a master. He knows the buttons to push, right? And from there, right, you talk about the wall, you talk about scapegoats, you talk about things that are really a direct line to violence. Right? These all have emotional resonance. They capture people's attention. They get people ginned up. It can be the source of great suffering, as we saw in David Foster Wallace. It could be the source of great creativity. Right? The fact is, and I think this is important, whether it's somebody who's in pain or somebody who's suffering from mental illness, it's not that the person is broken. We're all vulnerable. This is part of our natural circuitry. Capture's universal.
Mm-hmm. Is there a prescriptive aspect to this theory? So, and to bring it to bear, although I'd love to hear the answer to the Trump problem at length, but to bring it back to opioid addiction, how does your theory come to bear on that, on opioid addiction? What can be done there to break that cycle of capture?
Take AA. Let's just talk about alcohol. We'll come back to the opioids, and then we'll deal with Trump in the last moment. Right? AA. Why does it work? I mean, we've been studying AA. I mean, it's probably as effective. The numbers are still, in question. We don't have good randomized controlled trials, right? But it's probably among the most effective treatments for alcoholism. Why? Because here's the secret. The only way you can deal with when you're captured is to find something that captures you more, that's more meaningful, right? So I go from a life of alcohol, where I'm constantly cued, right, to a life of fellowship, right? Alcohol was my friend, now it's become my enemy. Right? And the sense of that fellowship, the way that critical perceptual shift that AA occurs, I viewed it, alcohol as positive, now I view it as negative. So how we view drugs, I mean, is very, very important. What's the antidote to Trump? I mean, you look at those experiences of hatred and bigotry and rage, right? What's leadership about? I mean, it should talk about the positive, not the negative, because we're all subject to capture. That's why this is so dangerous.
I want to ask you about one more question about pain, but I'm going to do it after. First, let's take a few questions from the audience, if there are any. Yes. Hold on, there's a microphone coming.
Hi, Samira Daniels. Just to follow up on this understanding of capture, I'm wondering whether either of your explanations, the characterizations, go to the issue of how the nature of the goals and objectives in society, how those can also lead to mental illness. And I think that that is something that, you know, we don't pay as much attention to.
What a fascinating question, right? I mean, because what captures me? What captures me is what's meaningful to me, what becomes salient to me. But it's not just my brain, it's the way my brain interprets the world, right? So how do I, as a person, decide what's meaningful for me, right? What are the experiences? And what are those values that society gives us that make certain things meaningful, right?
Any other question? Oh, yes, right here.
Barbette Bailey from Kaiser Permanente, but I'm here more on a very like emotional, deep, how it was affected my son when he was affected with mental illness. So when you say capture, I really was not captured with interest on the topic up until October 2014, when my son had a major psychotic episode and ended up in the hospital. And at that point, the capture was an emotional chord that tapped. It was like, I felt like, you know, it's like a jolt. And it was like my awareness, the paradigm shift. So how do we shift the paradigm of the masses to tap into the emotional chord that captures the interest that move it in a positive way for, yeah.
Well, I would say this conversation today is elevating that, because I'm sure, I hope you have not, but unfortunately, lots of patients with mental illnesses are still stigmatized, which means we don't want to talk about it. And so no one talks about it, and then those who are affected by it are sometimes afraid or ashamed to talk about it. And so I think I'm very anxious to read Dr. Kessler's book, but I believe on the animation, the brain. The brain was the most important photo up there, because we have to understand that although that the brain is connected to the rest of the body, and for many years we thought folks who had mental disorders or substance use disorders had a moral failing, a character weakness. We talked about folks with substance use disorders as junkies and stoners. We really have to, what I mentioned earlier, was make sure we are using appropriate language and elevating the conversation. And I think when folks start to think about the brain as they think about the pancreas with diabetes, you know, mental disorders, substance use disorders are chronic illnesses, just like diabetes and hypertension. Not curable. There's not a one-size-fits-all approach. But we can work in a complex biopsychosocial way. First, seek to understand, and then to offer treatment. So I think this conversation is helpful in elevating that and getting the word out to those who typically only have to understand it when there's a crisis.
I wish we could go a full hour, but that's it for us.